Hey there! Let's talk about something that concerns all of us: skin cancer. It's one of the most common types of cancer in the United States, and while it's a serious condition, there's good news. Early detection can make a world of difference. In fact, studies reveal that the 5-year survival rate for skin cancer diagnosed in its early stages is an impressive 99%. However, if it spreads to your lymph nodes, that rate drops to 65%, and it plunges to a daunting 25% if the disease affects distant organs. Clearly, spotting it early can save lives. Today, we're diving deep into the early warning signs of skin cancer, exploring the different symptoms across various types, and learning about helpful detection methods. Let's get started. Why skin cancer happens and where it strikes. One of the leading causes of skin cancer is prolonged exposure to harmful ultraviolet rays, which can damage the DNA in skin cells, disrupting their normal growth and function. This DNA damage leads to abnormalities that can result in the uncontrolled growth of cells, forming tumors. But did you know skin cancer doesn't only develop in sun-exposed areas like your scalp, face, neck, arms, or legs? Surprisingly, it can also appear in unexpected places, including your palms, under your fingernails or toenails, and even in private areas. These less common sites are often linked to melanoma, the most aggressive type of skin cancer, which can develop even without significant sun exposure. Understanding this broad risk spectrum highlights the need for a comprehensive approach to prevention and detection. Spotting the early signs. Detecting skin cancer early is crucial for effective treatment. Experts recommend a thorough head-to-toe skin examination every month. This proactive approach allows individuals to catch any abnormalities before they progress. Be on the lookout for any new moles or growths that weren't there before. Changes in existing moles, such as rapid growth, darkening, or alterations in texture, are also warning signs. Lesions that bleed, dry out, and fail to heal should not be ignored. Additionally, keep an eye out for patches or spots in unusual shades like pink, brown, or darker tones. These could be the first indicators that something's wrong, prompting an immediate visit to a healthcare provider. Do different types of skin cancer have unique signs? Number 1. Basal cell carcinoma. Basal cell carcinoma is the most common form of skin cancer, accounting for about 80% of cases. While it is less aggressive and rarely spreads to other parts of the body, it can cause significant damage to surrounding tissues if left untreated. Basal cell carcinoma often appears on sun-exposed areas such as the face, scalp, ears, and neck. The signs include red, irritated patches that may itch or crust, or flat, pale, or yellowish areas that look like scars. You might also notice pink, pearly bumps with visible blood vessels or sores that ooze crust over and keep coming back without healing. Interestingly, basal cell carcinoma develops slowly and is more likely to affect individuals with fair skin or a history of excessive sun exposure. However, anyone can develop it. If you notice a persistent sore or an unusual spot on your skin, don't ignore it. Consulting a dermatologist early can lead to effective treatment, typically through excision or topical therapies, and prevent further complications. Number 2. Squamous cell carcinoma. Squamous cell carcinoma is the second most common skin cancer, representing about 20% of all cases. It is more aggressive than basal cell carcinoma and has a greater risk of spreading to lymph nodes or other organs if left untreated. Squamous cell carcinoma often manifests as firm, red nodules that might bleed easily or as scaly, crusted lesions on sun-exposed areas like the face, ears, and hands. In some cases, squamous cell carcinoma appears as wart-like growths that persist or even grow despite treatment. A lesser-known fact about squamous cell carcinoma is that people with darker skin tones are at higher risk of developing it in areas less exposed to the sun, such as the soles of the feet, palms, or under the nails. This highlights the importance of regular skin checks for everyone, regardless of skin tone or sun exposure history. Early diagnosis and treatments like cryotherapy, surgery, or radiation can effectively manage squamous cell carcinoma and reduce the chances of severe outcomes. Number 3. Melanoma. Melanoma is the most dangerous form of skin cancer. It arises when pigment-producing cells, melanocytes, grow uncontrollably. Although it's less common, melanoma is notorious for spreading quickly, making early detection vital. The good news is that medical experts have developed two methods to help identify melanoma: the ABCDE rule and the ugly duckling method. These tools are easy to remember and can guide you in identifying suspicious moles that need medical evaluation. Number 1. The ABCDE rule for melanoma detection. The ABCDE rule is an easy way to examine suspicious moles and identify potential melanomas. Each letter corresponds to a key characteristic to look for. A. Asymmetry. Melanomas often have uneven shapes. If you divide the mole in half, the two sides won't match. This irregularity is a significant red flag. B. Border. Harmless moles usually have smooth, well-defined edges. Melanomas tend to have irregular or blurred borders that stand out upon close inspection. C. Color. Be wary of moles with multiple colors or unusual hues like red, blue, or white. These variations often indicate something amiss. D. Diameter. Melanomas are typically larger than the eraser on a pencil, but size isn't the only factor. Any growth in diameter should prompt further investigation. E. Evolving. Any change in size, shape, color, or texture over time is a red flag. Also, watch for itching, bleeding, or crusting, as these symptoms often accompany melanomas. Number 2. The ugly duckling method. The ugly duckling method is a straightforward yet powerful tool for identifying potential melanomas. The concept revolves around spotting moles that stand out as different from the rest, much like the ugly duckling in the classic fairy tale. For example, if you have a group of moles that look similar in size, shape, and color, but one appears noticeably larger, darker, or irregular, it warrants closer attention. This approach also applies to isolated moles that don't match the overall pattern of moles on your body. The key is comparison using your natural mole pattern as a baseline to identify the odd one out. While this method can empower individuals to monitor their skin proactively, it's important to remember that only a dermatologist has the expertise to determine whether a mole is cancerous. If you notice anything unusual, don't hesitate to seek professional evaluation. It could save your life. Diagnosing skin cancer. If you notice any abnormal signs on your skin, the next step is to consult a dermatologist. Here's what you can expect during the diagnostic process. First, your doctor will ask about your personal and family medical history, especially concerning skin cancer. A thorough physical examination of your skin will then be conducted to identify unusual moles or growths. A dermatoscope, a handheld magnifying device, may be used to provide a closer look at the suspicious areas. If your doctor spots anything alarming, they might take a small sample of the affected area for a biopsy. This simple procedure involves analyzing the sample in a lab to confirm whether it's cancerous. Early diagnosis can make a significant difference in treatment outcomes, so don't delay seeking medical help. Prevention is key. When it comes to skin cancer, prevention truly is the best medicine. The leading cause of skin cancer is UV damage, so shielding your skin from harmful rays should be a top priority. Start with a broad-spectrum sunscreen with at least SPF 30 and apply it generously. Even on overcast days, UV rays can sneak through clouds. Reapply every 2 hours, especially after swimming or sweating. Pair your sunscreen with protective clothing, such as wide-brimmed hats, UV-blocking sunglasses, and long-sleeved shirts. Avoid tanning beds altogether, as they emit concentrated UV rays that significantly raise your cancer risk. Don't forget to perform monthly self-checks to spot any changes early, and make annual appointments with a dermatologist for a professional skin exam. These proactive steps not only minimize your risk, but also help you catch any potential issues early. Remember, a few small adjustments to your routine can go a long way in keeping your skin healthy and cancer-free. That's all for today's video. If you found this video helpful, share it with your loved ones, and let's spread awareness together. Don't forget to subscribe to our channel for more life-saving insights and hit the bell icon so you never miss an update. Stay safe, take care of your skin, and empower yourself with the knowledge to protect your health.